So the next part of my assessment is going to be the patient's neck. You're basically looking for symmetry on both sides of the neck, looking for freedom of movement. The patient should be able to move their neck freely from side to side, up and down. There should be no crepitus in the movement. Next, you're looking at the trachea. You want to make sure that that's midline, not deviated to either side. I'm going to palpate the carotid artery once on each side at a time to make sure that you don't stimulate the vagal nerve, which can affect the cardiac system. Next, I'm looking at the supraclavicular lymph nodes, which is just under the patient's maxilla. You should be able to feel those. You should not be able to feel those bilaterally. They should not be enlarged or swollen. Again, the range of motion, patient should be able to flex, extend, and rotate their neck without any pain. Moving on to the neurologic system, I'm going to assess the patient's mental status, making sure that they're alert and oriented, that they can follow commands. Some different cranial nerve tests that you can do. Again, looking at the pupils, looking at their reactivity and accommodation with your pen light. You can ask the patient to extend their tongue and move it side to side. You would ask the patient to smile, and you're looking for symmetry on each side of that smile. You can ask them to raise their eyebrows, making sure that they have appropriate strength to raise their eyebrows, making sure that they're oriented to the situation, knowing where they are, why they're here, the situation. Next, moving to the upper extremities, we're looking for the CMS. It stands for circulation, movement, and sensation. Those three systems should be intact, so basically we're looking to make sure that the upper extremities have appropriate color. I'm going to check cap refill on each of the extremities, making sure that blood returns to the fingers within 3 seconds or less. Making sure that their temperature is appropriate, their skin should be warm and dry. Again, I'm going to test sensation on their upper extremities by gently touching the skin on their hand and asking them if they can feel that. Next, I'm going to assess joint mobility. The patient should be able to move all their joints on their upper extremities. Their wrists, their elbows should be able to flex, extend without any crepitus, any tenderness. There should be no nodules in the joint. Their range of motion should be a 0 to 3+. It should be symmetrical on both sides. Next, I'm going to move on to the anterior thorax. So I'm looking at the chest here. I want to make sure that the shape is symmetrical. I would ask the patient to recline at this time. I'm going to make sure that the skin is intact on the chest. There should be no rash, lesions such as hives. I'm going to look at their breathing. I'm going to look at the rate, the depth, the pattern. You're assessing for any distress here. Next, I'm going to take my stethoscope and listen to their breath sounds on all regions of the anterior chest. So, on all regions, bilaterally, making sure they're the same on all sides. Next, I would then auscultate the precordium over the point of maximum impulse. That is near the apex of the heart. I'm going to listen to the heartbeat for a full 60 seconds. And you're assessing here for any heaves, thrills, murmurs. All those things are abnormal. The rate of the heart should be between 60 and 100 beats per minute. There should be no murmurs, no gallops, rubs, anything of that nature. Next, I'm going to percuss the chest in all regions. So using my non-dominant hand, I'm going to place my palm on each region of the patient's chest and sharply percuss. Over the lung fields, there should be a resonant percussion sound, and over the heart, it should be dull. Next, I'm going to assess the carotid artery. On each side, it should be symmetrical. You shouldn't feel any bruits or thrills there.